Bring home this adorable little fluff ball, a puppy just full of promise. But then weeks, maybe months go by and something seems, well, a bit off.
Hmm.
They're still tiny, perhaps not growing quite like you'd expect. You might think, okay, breed size, or maybe they're just a picky eater.
Right, the usual suspects.
Exactly. But what if the real answer lies hidden in a tiny yet incredibly important part of their body? What if that stunted growth wasn't just about the obvious things?
And that's the fascinating puzzle we're getting into today. We're doing a deep dive into canine hypopituitarism.
Hypopituitarism. Okay.
It's a condition centered around the pituitary gland.
Mhm.
You can sort of think of it as the master control center for hormones in the body,
The big boss.
pretty much. And when it isn't working correctly, the knock-on effects, the ripple effects can be really significant.
Right. So we've got the details laid out from our source on canine hypopituitarism, and our mission today is basically to unpack this condition for you.
Hmm.
We'll explore, what causes it, what are the telltale signs you might see, and what it actually means for these dogs, and, of course, their owners.
And we're aiming to go beyond just the dry medical definition here.
Yeah, definitely. We want to explore the intriguing and sometimes, honestly, quite touching realities of this condition.
Okay, so at its core, canine hypopituitarism involves damage or sometimes destruction of the pituitary gland.
Okay.
Now, this isn't like a single isolated problem. Because the pituitary is this central hub, its malfunction leads to low production of several key hormones.
Well, not just one.
Not just one. Imagine like an orchestra conductor whose baton suddenly falters. Several sections of the orchestra, thyroid, adrenals, reproduction, growth, they all get affected.
That's a great analogy.
We're talking about hormones like TSH for the thyroid, ACTH for the adrenals, the reproductive hormones LH and FSH, and crucially, growth hormone, or GH.
Wow. Okay. So this tiny little gland really has its fingers in a lot of pies, doesn't it?
It absolutely does.
When it hiccups, a whole cascade of other systems can just go slightly haywire.
Precisely. And because these hormones are so fundamental, so basic to various bodily processes, the consequences of hypopituitarism can be pretty wide-ranging.
Now, who typically gets this? Is it just sort of random bad luck across the board, or are there specific clues or maybe patterns that owners should be watching out for early on?
Well, there are definitely things to look for, particularly in terms of when symptoms tend to pop up.
Okay.
We often see the first really noticeable signs between 2 and 6 months of age.
That young.
Yeah, and that's a really important window, because puppies at this stage are usually in their major growth spurt.
Right, they shoot up.
Exactly.
Yeah.
So if a puppy isn't hitting those growth milestones like its litter mates, that's a signal that something might be, well, up.
And are there specific breeds that seem more prone to this condition? Is there a genetic link?
Yes, definitely. There are certain breeds where we unfortunately see hypopituitarism more frequently.
Okay.
German Shepherds are a big one, and also Karelian bear dogs. And what's really interesting there is that in those breeds, we often find a pretty straightforward genetic cause. It's usually passed down through what's called a simple autosomal recessive pattern.
Meaning inherited from both parents.
Correct. It's linked to a specific mutation in the LHX3 gene. Think of it like needing 2 copies of a tiny error in the blueprint, one from mom, one from dad, for the condition to actually show up.
Fascinating. Any other breeds?
Yeah, others like the Spitz, Toy Pinscher, and Weimaraner have also shown a sort of higher likelihood. This genetic piece, especially in German Shepherds and Karelians, is really significant for breeders and owners to be aware of.
That's a really crucial point. So if you're thinking about getting one of those breeds, understanding this potential issue is, well, it's vital right from the get-go.
Absolutely.
What kind of things might owners have noticed historically? Like looking back, what were the early, maybe subtle indicators?
Well, historically, owners sometimes describe what they saw as significant learning difficulties, particularly with housebreaking.
Really?
That-
Like trouble training?
Yeah, almost like the puppy is struggling with basic training for much longer than you'd typically expect. They might also just notice, very simply, that their puppy isn't keeping pace growth-wise with litter mates in those first 2 or 3 months.
Okay.
And a key physical sign, something quite specific, is what we call proportionate dwarfism.
Proportionate dwarfism, what does that mean exactly?
It means the dog is smaller than expected overall, but its body parts, legs, head, body, are still in relatively normal proportion to each other.
Ah, okay. So not like, say, very short legs on a normal-sized body.
Exactly. Unlike some other conditions that cause stunted growth where you might see those disproportionate features, here they look like a miniature but well-proportioned version of the adult dog.
That's a really helpful distinction. Now, what about when a vet actually examines a puppy they suspect might have this? What physical signs jump out?
There are several physical findings that are quite characteristic, yeah. One is that the puppy often keeps his soft, fluffy puppy coat for way longer than normal.
Oh, the forever puppy look.
Kind of. It makes them look perpetually very young. The skin might also feel unusually thin, maybe lacking that normal firmness. We call that hypotonic skin.
Interesting.
And some affected dogs also have very distinctive bark, high-pitched, maybe a bit shrill.
A shrill bark. Huh.
Yeah. You might also see hair loss, mostly on the body that's truncal alopecia, and sometimes a darkening of the skin underneath, which is cutaneous hyperpigmentation.
Okay.
Other clues. Underdeveloped external genitalia, so things look infantile, and a noticeable delay in when their adult teeth decide to make an appearance.
Wow, okay. That paints a really clear picture of the physical signs someone might spot. Let's dig into the why a bit more. What actually causes this damage or malfunction in the pituitary gland?
Right, the causes, we can broadly split them into two buckets, those present from birth congenital and those that develop later in life acquired.
Makes sense. So congenital first.
Sure. Among the congenital causes, one notable factor is something called a cystic Rathke's pouch.
Rothke's pouch.
Yeah, it's basically a developmental hiccup where a fluid-filled sac forms near or within the pituitary gland during development in the womb.
And that causes problems?
It can, yeah. It might press on the gland, interfering with its normal function. We can also see cases where there's just an isolated deficiency of growth hormones specifically, while the other pituitary hormones seem okay.
Okay, so it could be a structural issue or just one specific hormone missing from the start.
Correct.
And what about things that happen later? What are the acquired causes?
Acquired causes can include the growth of a tumor on the pituitary gland itself.
Like cancer.
It can be, yeah. As the tumor gets bigger, it can physically squeeze and damage the normal pituitary tissue around it.
Ouch.
Trauma is another one. A significant head injury could potentially damage the pituitary area.
Okay.
And in some unfortunate situations, if radiation therapy is needed to treat a tumor nearby, say in the brain, the radiation itself could accidentally damage the pituitary gland as a side effect.
Right, collateral damage, essentially.
Exactly.
So it can be something a dog is born with or something that happens down the line. Now, if a vet suspects this, hypopituitarism, what's the process? How do they nail down the diagnosis? What's the detective work involved?
Diagnosis is super important, and a huge part of that is ruling out other things first.
The differential diagnosis.
Precisely. It's like being a medical detective, eliminating suspects. For instance, there's a condition called hypothyroid dwarfism that also leads to stunted growth.
Oh, okay. How's that different?
Well, it often pops up in different breeds than those usually hit by hypopituitarism. And the dwarfism itself can look different, often more disproportionate, like we talked about earlier. The body proportions can be a really key clue.
Gotcha. What other conditions would a vet need to cross off the list?
Oh, several others, really. Things that can cause a puppy to fail to thrive or not grow properly, like liver problems, specifically portosystemic shunts.
Shunts, right.
Yeah. Also diabetes mellitus, although may be less common in very young pups, causing just stunted growth. Another hormonal issue called hyperadrenocorticism, or Cushing's disease, and then more basic things like severe malnutrition or a really heavy load of internal parasites.
So quite a list to work through.
Absolutely. A thorough workup is definitely needed to exclude all those other possibilities before landing on hypopituitarism.
It sounds like it's not always a straight line to the answer then. What specific tests do vets actually use?
We usually start with the baseline stuff. A complete blood count, CBC, a biochemistry profile looking at organ function and electrolytes, and a urinalysis.
Standard blood work and urine tests.
Right. And while these might not scream hypopituitarism, certain findings can raise our suspicion. Things like maybe increased numbers of certain white blood cells, eosinophils, and lymphocytes.
Okay.
Low levels of phosphorus in the blood, which is hypophosphatemia, or sometimes low blood sugar, hypoglycemia, little clues.
So suggestive, but not definitive.
Exactly. Then we move on to more specific hormone tests. We often run what are called stimulation tests. For example, an ACTH response test.
How does that work?
We measure cortisol levels, give an injection of ACTH, and then measure cortisol again. It tells us how well the adrenal glands respond to the pituitary signal. In hypopituitarism, the response is often weak or subnormal.
Because the pituitary isn't sending the signal properly in the first place, or the adrenals have sort of shut down from lack of signal.
Kind of both, potentially. The pituitary isn't making enough ACTH usually. We might do a similar thing for the thyroid using a TSH response test, though TSH itself can sometimes be measured. Again, looking for a subnormal response.
Okay. And what about directly measuring the pituitary hormones themselves, like growth hormone?
Well, that's where it gets a bit tricky in regular practice. Directly measuring canine growth hormone levels would be ideal, wouldn't it?
Seems logical.
But a consistently reliable, readily available GH test isn't really a routine thing in the US, for example. It's often more of a research tool.
Okay. So how do you work around that?
Because of that limitation, we often measure something called insulin-like growth factor 1, or IGF-1.
IGF-1.
Yeah. The liver makes IGF-1 when it's stimulated by growth hormone.
Mm.
So if growth hormone is low, IGF-1 levels are usually low too. It's a strong indirect indicator.
So measuring the effect rather than the cause directly?
Pretty much. There's also something called a ghrelin stimulation test, which looks at how GH levels change after giving ghrelin, but again, that hinges on having access to that GH assay.
Right.
And, of course, for those breeds with that known genetic link, like the German Shepherds.
The LHS3 gene.
Exactly. DNA testing can be incredibly helpful. It can tell you straight up if the dog has the mutation associated with the condition in that breed.
That seems very definitive, at least for those specific breeds.
It is, yeah. Very useful.
And I think you mentioned imaging before. Can X-rays help?
Absolutely. X-rays or radiographs can definitely provide more clues. Yeah. We might see characteristic changes in the bones, like epiphyseal dysgenesis. That's abnormal development of the ends of the long bones where growth happens. And we might also see that the growth plates themselves.
The bits that make bones longer?
Yeah, the physeal growth plates. They might still be open or abnormally retained when they should have closed based on the dog's age. These visual clues on the X-rays add more weight to the diagnosis.
Okay, so putting all that together, the history, the exam, the blood tests, hormone tests, maybe DNA, imaging, you can build a strong case.
That's the goal, yes. A comprehensive approach.
All right, so we've journeyed through how this condition is identified. Now, the big question, what can actually be done to help these dogs once they have a diagnosis? What are the treatment options?
Well, the good news, relatively speaking, is that in most cases we can manage canine hypopituitarism. It's typically done with outpatient medical treatment. No major surgery usually required for the hormone deficiencies themselves.
Okay, that's encouraging. And what kinds of medications are we talking about?
The most direct approach, logically, is to replace the missing growth hormone.
Makes sense. Give them what they're lacking.
Right. Now, availability can be an issue, but we can potentially use human, porcine, pig, or bovine cow growth hormone.
Is it given as a pill?
No. It's usually given as an injection under the skin, typically about 3 times a week for a course of maybe 4 to 6 weeks. This cycle might need to be repeated depending on the response.
Okay. Are there other options besides growth hormone?
Yes. Another medication that's sometimes used is medroxyprogesterone acetate. It's a type of progestin.
How does that help?
It seems to stimulate the mammary gland to produce growth hormone, believe it or not. It's often given as an injection into the muscle, maybe every 3 weeks initially. And then the frequency might be reduced once the dog has reached a more normal stature to help maintain it.
Interesting workaround.
It is. And very commonly, these dogs also have secondary hypothyroidism because the pituitary isn't making TSH.
Right, that thyroid hormone issue.
So if that's the case, we'll prescribe levothyroxine, which is synthetic thyroid hormone, to be given by mouth every day.
Standard thyroid treatment.
Exactly. And one more piece. Remember the ACTH for the adrenal glands.
Yes.
If the ACTH response test showed that the adrenals aren't responding properly, meaning the dog's also ACTH deficient, we'll need to give glucocorticoids, usually something like prednisone.
Steroids.
Yeah, typically at a low daily dose to replace what the body isn't making. And here's a really important point, that dose needs to be increased during times of stress.
Stress, like what?
Like if the dog gets sick, has an injury, needs surgery, or even just significant emotional stress. Their body can't naturally ramp up cortisol production like it should, so we have to do it for them with extra medication temporarily.
That's crucial for owners to know. Are there any significant side effects or things owners need to watch out for with these treatments, especially the growth hormone?
Yes, definitely. With growth hormone treatment, we need to be vigilant for potential allergic reactions, maybe at the injection site. And a big one is the potential for developing carbohydrate intolerance.
Meaning?
It can interfere with how the body handles sugar, potentially leading to high blood sugar, almost like diabetes.
Oh, wow, okay.
So careful monitoring for that is absolutely crucial.
Speaking of monitoring, what does the ongoing care look like? How do you keep tabs on these dogs?
Regular check-ins with the vet are key. Owners need to monitor at home too, maybe watching water intake or urination.
And the vet checks.
We'll need to periodically check blood glucose levels,
Okay.
especially if they're on growth hormone, and also check their urine for glucose. If we start seeing sugar consistently in the urine, or if blood glucose levels creep up and stay above a certain level, we'd likely need to stop the growth hormone treatment to avoid inducing diabetes.
Right, managing the risks.
Exactly. We also need to be mindful of those potential complications we touched on earlier.
Yeah.
For example, if the underlying cause was one of those Rathke's pouch cysts.
The developmental sacs.
Yeah. There's a chance it could expand over time and start pressing on the brain, causing neurological problems like seizures or changes in behavior.
So that needs watching too. And looking at the bigger picture, what can owners realistically expect long-term for a dog diagnosed with hypopituitarism? What's the usual journey of the prognosis?
Well, treatment can certainly improve some things quite noticeably. The skin and coat condition, for example, that often gets much better within, say, 6 to 8 weeks of starting growth hormone and thyroid meds if needed.
So they start looking healthier.
Yes, absolutely. But it's important to set realistic expectations about their final size.
They don't suddenly shoot up to normal height.
Generally, no. By the time diagnosis happens and treatment starts, the growth plates in their bones have often already closed or are very close to closing, so we usually don't see a significant increase in their final adult height. They'll likely remain smaller than average for their breed.
Okay, that's important to understand.
Unfortunately, the long-term prognosis is often described as guarded.
Guarded. That doesn't sound great.
No. Many dogs with congenital hypopituitarism tend to have a shorter lifespan than unaffected dogs. Often they might pass away at a relatively young age, perhaps around 3 to 4 years old.
Why so young?
It's often due to those potential neurological complications, like if a cyst expands or sometimes kidney failure can develop down the line too. It's a really challenging condition in the long run, and that guarded outlook is often a difficult reality for owners to face.
Yeah, that's definitely tough to hear. So summing up, this is a relatively uncommon condition, but clearly really significant, especially if you own one of those predisposed breeds.
Absolutely.
And it involves this complex web of hormone problems, all stemming from that tiny pituitary gland not doing its job properly.
That's it in a nutshell.
And it really sounds like spotting those early signs, the slow growth, the puppy coat, maybe the training issues, and getting to the vet quickly is just vital.
Crucial. Early recognition and veterinary intervention are key for managing the condition and trying to give these dogs the best possible quality of life, even with that guarded long-term prognosis.
Understanding the diagnostic process, knowing what treatments are available, it all helps paint the picture.
It does. Recognizing those signs, particularly in those at-risk breeds like German Shepherds, is step one. And then understanding the range of diagnostic tools and management options we have is essential for tailoring the approach to each dog.
This deep dive really highlights, I think, just how intricate our dogs' bodies are, doesn't it? How these tiny little components like the pituitary gland can have such massive, far-reaching effects.
It truly does. It's a complex interplay.
And thinking about that genetic component, especially in breeds like the German Shepherds, it definitely makes you pause and consider the ethical side of breeding practices, right? Thinking about how to minimize the chances of conditions like this appearing in future generations.
That's a really important consideration, definitely. Responsible breeding, potentially using genetic testing where available, plays a huge role.
Something for all of us, especially breeders and potential owners of these breeds, to think about. Well, thanks for walking us through all that.
My pleasure. It's a fascinating, though challenging condition.
It really is. Thanks everyone for joining us on this deep dive into canine hypopituitarism.